Radiofrequency ablation is a technology that uses thermal energy, so heat, which is distributed through a probe. The probe is entered into the thyroid nodule through the neck, and that heat that's generated within a thyroid nodule essentially destroys the cells from the inside and allows the nodule to gradually shrink as the cells are destroyed. It's for the most part used to treat benign thyroid nodules. Some parts of the world have started to use it to treat cancers as well. In terms of the option that a patient chooses, a lot of it has to do with patient preference. Again, if we're focusing on benign thyroid nodules, those nodules can be just followed, that's as in watchful waiting and surveillance, because they're no real threat to the patient. However, some of those benign nodules do cause symptoms such as local pressure in the neck, a sensation that there's something stuck in the patient's throat. They may feel that it's affecting their voice somewhat or affecting their breathing. So those are patients who, despite having benign nodule, may want to have it treated, at which point we'll discuss the pros and cons of performing open surgery to remove that side of the thyroid gland that contains the nodule versus radiofrequency ablation, which has advantages in that it's non-surgical and doesn't require an anesthetic, but there are pros and cons to each, and those need to be outlined clearly for the patient. So RFA, for the most part, is done under local anesthetic. In our office, that's the way we perform it. Some centers may use some sedation for patients, but in our experience, it really is not necessary, and the patients tolerate it very well under local anesthetic. In terms of the duration, it really depends. The treatment time depends on how large the nodule is. We calculate the volume of the nodule, and nodules that have larger volumes require a longer treatment because more energy needs to be delivered in order to have a satisfactory result. Smaller nodules will take a less amount of time. I would say, depending on nodule size, it ranges anywhere from 15 minutes to perhaps 45 minutes. So the procedure of RFA requires the patient to come in and lie on the same table that they probably had their biopsy on. It'll be a very familiar setting for them. The patient is usually given one pill of Ativan, which is a short-acting sedative, just to relax them. And then we freeze the neck in the very same way as it was frozen for their biopsy. We use a little bit more anesthetic because the procedure takes a little longer and it's a little more involved, but that for the patient really is not significantly different than the biopsy. Once they're well frozen, we use our ultrasound to identify exactly where the nodule is and the extent of it. And at that point, we will introduce a needle or a probe, pretty much the same thing, into the nodule and start to generate that thermal energy that we spoke about earlier. We will treat the nodule as comprehensively or as completely as possible. And again, as mentioned earlier, a smaller nodule will be treated more quickly. A larger nodule will take a little bit more time. We'll have to move the probe around to a wider expanse and generate a little bit more energy using higher energy settings in order to destroy as much of the nodule as possible. During the procedure, patients have reported that they feel really very little. They feel the freezing. And during the procedure, while it's actually happening, they may feel some heat. They may feel heat extending down towards their chest or up towards their neck, but nothing that is significantly uncomfortable. Afterwards, the patients will then apply ice to their neck. We'll apply an ice originally here, and then they'll apply some ice when they get home for a few hours. And most patients are back doing their regular activities, be it work or school or whatever is part of their daily life by the next day. So a few of the risks that we mentioned to the patient, as well as several others, but the most common ones is there may be a little bit of discomfort during the procedure, but usually very, very manageable. There may be some mild discomfort afterwards, which is usually managed with Tylenol and ice packs. There could be some bruising of the skin afterwards. Sometimes there's swelling, which, as mentioned, the ice packs help deal with. We sometimes have to give anti-inflammatories. We are generating heat in the neck. There's nerves in the neck. So just as we have to explain to patients that the nerve to their vocal cord sometimes can be affected during thyroid surgery, the same with radiofrequency, with less probability than with thyroid surgery, but the nerve can be temporarily weak, very, very rarely permanently weak, which can affect their voice. Sometimes there is a skin burn that has to heal, or a small wound that is draining as the nodule is being absorbed. So those are some of the risks. There's several others that we go through as we discuss RFA with the patient, but all of these are low likelihood of occurring. So this process of the nodule shrinking is something that happens over months to even a year. Even at the 12-month period, we'll often notice that the nodule has shrunk from what it was at 9 months. So it's a slow process. Having said that, when I see the patients back at 3 months and measure the nodule, even if I see a 10 to 20% reduction in nodule volume, those patients often will say that they feel less pressure. I think a lot of it depends on what symptoms the patient is having. It also depends on how large the nodule was to start with. That has an important bearing on the time frame that it takes for them to notice the benefit.